Hey guys, Kristen back here again, and in this episode we are discussing the treatment of ulcers in horses. Real quick, I do want to go a little bit of an overview because there is some slight differences of types of ulcers, and so in the treatments of that, it will be dependent on what kind of ulcers you really have.
And what your veterinarian tells you.
Yeah. Remember, everything that we talked about in this video and even other videos and everything else is our opinions, our anecdotal evidence, so to speak. Everything else, we are not vets, and always check in with your vet and get expert opinion.
Yeah, so we're gonna do a deep dive and talk about how we treat ulcers.
And what we do with that and everything else. So you have foregut ulcers, which is the front gut of the horse. You have the hindgut ulcers, and you have gastric ulcers, and there's different grades of the ulcers. Some can be very minimal, not super open, and then the higher grades, they are worse, to the point that you can have in horses like bleeding ulcers and glandular ulcers. So the severity of that, the only way to really know like how bad the ulcers are with your horse would be to scope. Now, for me personally, and if for the most part you are kind of similar or not, if we suspect ulcers, we are just going to treat. I don't particularly scope unless I think it's absolutely necessary for if it seems very, very severe. But for me, because getting the scoping done and getting all that done to look at that is very, very stressful and very hard on the horses. And you're just going to be really exacerbating a lot of the issues. And the treatment's going to end up being roughly the same anyways. So if I'm suspecting ulcers, I'm going to treat.
And so part of that is because you have to fast them for long periods of time before you do scope, because they need to have no food left in the stomach. So we know fasting that can cause ulcers.
Make it worse.
Yeah.
And then you're having to trailer them to your vet, and then they have to be sedated. And they're having a camera.
And now I will tell you that there are some vets that adamantly disagree with this approach of treating without scoping. And if that is what your vet is telling you, please go with that approach.
So the main treatment that I do is kind of twofold. So there's Omeprazole, also known as GastroGard or UlcerGard. So GastroGard is your prescription version of UlcerGard. So GastroGard is what you would get through your vet. You can also get it through like Chewy or some other places, but you have to have the prescription from your vet. UlcerGard is the same. It is over the counter that you can get at Tractor Supply, your local feed store, potentially. Not every feed store will carry it, but you can go on Amazon, again, Chewy, Smart Pack, all those places. A lot of horse sites, even ones that aren't really feed ones, like my last few that I had gotten, I got from Dover Saturday, because I shopped around for the cheapest price. It is not cheap. It is quite expensive.
But they've come up with a new one that's coming out in the market called Gastrobin.
So we'll talk about that.
It's a generic.
A little bit. But the reason I do go with the UlcerGard and that Omeprazole is because it is a patented formula that has a timed release. So when you are particularly treating, because you can also use it for prevention, but in the treatment of ulcers and everything, you want that time release because it doesn't use all of the active ingredients at once. It goes over a period of time. And that's why when treating and everything, you do a full tube, possibly more depending on the size of your horse. If you have a large horse, you will need to do more.
The dosage is by pounds.
Yeah, dosage by pounds, but you do that and then it releases over and you do 1 tube or more per day for your horse. The other part of the treatment that I do, and I recently did this with one of my mares, is Sucralfate.
Can I digress? You should treat and use UlcerGard on an empty stomach. So if you can, you want to give it like first thing in the morning too, before the horse is eaten.
Yeah.
It maximizes the horse's ability to absorb it. So.
Yeah. The other part is Sucralfate because, as we mentioned in the beginning, there's the foregut and the hindgut ulcers. And the different forms and different types. UlcerGard cannot reach the hindgut. So Sucralfate can. Sucralfate is in pill or powder form. It is prescription only. It's much cheaper than your UlcerGard. Much cheaper. Yeah. And both of those, whether you do one or the other or both, is a 30-day treatment. It is for a month, roughly. You can go longer, and some people do, and I have before. Sucralfate acts like a Band-Aid over the ulcers and protects that from the stomach acid. And it, Kristen brought up something earlier about Pepto-Bismol.
It's like, imagine the Pepto-Bismol commercial.
It really does, especially if you have used Sucralfate before. You've seen it because you can get powder or pills, but they're pink. They're bright pink. So you dissolve it, you crush it up, whatever. It's very Pepto-Bismol. Yeah, it is.
And I find sometimes if a horse is colicking, like I said, I'm not a vet. If it is because of ulcers, it will take away the pain quicker because UlcerGard heals ulcers. This also heals ulcers, but it also provides a protective coating, which makes them less painful. I'm not a vet.
So those are the two main things about treating ulcers and what I use. And as Kristen said, when you are dosing and treating and everything else, Omeprazole or your UlcerGard, GastroGard, the paste, you want to give at least a half an hour before they are fed. So typically we do it in the early morning before they get their breakfast. You want it on an empty stomach. You want it to have some time to coat and everything else. So Sucralfate you can give a little bit later. You don't have to wait for them to be on an empty stomach or anything. So the way that I've done it and have done for others with their horses, they get the UlcerGard at least a half an hour before breakfast, and then they get the breakfast, and then I like to just wait so that I'm not medicating too close together on different things. You don't necessarily have to do that, but I do like to give them a little bit of break because this stuff isn't tasty, so they can get a little.
And also, Sucralfate blocks the absorption of some nutrients. So you don't ever want to give Sucralfate and then UlcerGard. It generally needs to always be in the order of UlcerGard, empty stomach, then Sucralfate, because the Sucralfate can block the ability of the UlcerGard to get into the system. So it needs to be in that order.
And if for whatever reason you can't necessarily do it in that order, just space it.
Yeah.
At least an hour apart. But and you give the Sucralfate, and the Sucralfate you can give with food, or you can give on its own, whatever works best for your horse. I always do it with like food or something because it's not a very tasty thing. Most horses don't like it, and if they can taste it or see into it, they're not really going to consume it. If you don't have anything to give it with, or you just don't have enough because your horse doesn't need a huge amount of like some type of grain or something. One thing I did with a horse that was on it was he really loved Replenimash. And so I did a little bit of Replenimash, a teeny bit of water, just enough to dissolve the Sucralfate in. He gave it to that and he consumed the whole thing. He's like, delicious. Otherwise you can get like a syringe or something. You can dissolve the pills and just squirt it in their mouth.
Yeah. And sometimes you can put like a little bit of molasses on the end or applesauce to make it better as well.
A little palatable.
So there is a whole nother type of ulcers that we did not discuss here that is called glandular ulcers. And glandular ulcers, you don't treat with Misoprostol without being scoped. So that is a case for scoping. Because UlcerGard and Sucralfate won't really help glandular ulcers in the glandular region of the stomach. And I have given Misoprostol in the past. To me, it is a much stronger drug. And so I've had horses that have acted like kind of nauseous on it. They've gone off their feet a little bit. They seem mentally very different. So for me, that would be a case for scoping. And some people like to just go ahead and go to the scope, because there is unfortunately the symptoms for glandular ulcers are the same, and we will do another video on symptoms, as regular ulcers. So if you just want to get to the chase, find out what kind of ulcers your horse has, that is a case for scoping. I mean, we did have a horse here that I treated for 30 days with UlcerGard and Sucralfate, and it didn't do anything for him. And we took him in and we scoped him, and he had a whole mess of glandular ulcers. But like I said, I personally would never treat with Misoprostol without knowing that the horse has glandular ulcers because of the side effects that I've seen. And that is something too, every time you get a drug prescribed by your vet, or every time you give your horse a drug, please contact your vet and find out what the potential side effects are. Because there's nothing, you know.
And you want to be aware of it and what to look out for, right?
Yeah.
You want to know if what you're seeing is something that's kind of normal and just keep an eye on it versus like, oh, that's not a normal thing or a known side effect.
Yeah.
Right? And then you're like, okay, something else might be going on.
Right. So a known side effect of UlcerGard, GastroGard along those lines is acid rebound when you take them off of it. You can't just give them a whole tube and stop, where you shouldn't. Okay. Yeah. You have to wean them off. And that is something to discuss with your vet as well. I have a tendency to go really slow, even slower than what my vet says. I have a tendency to do like a half a tube for like 4 days, and then 2 tubes of a quarter tube after that. So I do a long weaning process after that initial 30 days. That's just me. Your vet might say something different, but it is important. Always go into treatments with medications, eyes wide open.
And then a final thought on this too is, I know that some people have done it before, and on like Facebook and some forums where there's vets and just different people asking questions, and the vets will answer it, and they're really great and gracious and everything, is human over-the-counter omeprazole.
Yeah.
It is omeprazole. It is. It's the same active ingredient and the same thing, and theoretically, it can treat and or prevent ulcers. The issue with it is, the dosage is set for humans. Our horses are a lot bigger than that. So you'd have to do the dosage calculation. A lot of people think that they'll go with that because they can save some money. But the reality is you're not going to be saving any money. You might be saving pennies. But the amount of medication that you would have to give, and typically it's in pill form. I think you can get some that's not, that's over the counter for people, but it's people dosage. You're still going to have to make that jump up in the dosage and give the according amount, which again, if you do that, talk to your vet. Don't guess.
Yeah, don't
guess.
You can do more damage than good.
Yeah. But the other thing too goes into what I mentioned in the beginning of why I like to use the paste and the UlcerGard at this point in time is because of the timed release. Because it is designed specifically for being active over a period of time where you can give it and let it do its job all day, basically. And then, yes, as Kristen mentioned, we want to wean off of whatever medications. I even wean my horses off of Sucralfate, and I've never really talked about having to do that, but I like to go down. So typically it's 10 pills twice a day, so 20 a day. So I'll go down to 15 pills a day and then 10 pills a day. And then by the time I'm at 5, I can then just start slowly going to nothing. But it's just weaning them off. So horses, because just like with people and any other animal, really, your body can get accustomed and acclimated to certain medications and the help and everything else and not really do what it's supposed to do if it's used to it too much and used to that help. So you want to kind of wean it off, but still have that assistance, the training wheels before just
don't shock the system. Yeah.
But especially the omeprazole and the paste, because it is one that can rebound really quickly for that. Yeah. So if you have any other thoughts, comments, how do you like to go about treating ulcers for yourself? If you have, just let us know, and I'll see you in the next one.